Unfortunately, our first speaker, Kiera, had to send in her apologies, but she did send me something to read out. As a little introduction to Kiera, Kiera's been involved in the co-design of the intervention, the SCI Healthcare Transition website, and has sat on the project's reference group. Kiera has qualifications in events and community service and fitness. She's a youth ambassador for Canteen, and she works as a childcare educator. So she's a busy young lady. I posed 4 questions to Kiera, and I will read out her responses. So my first question that I asked Kiera was, what was the experience like participating in the co-design of the website? And this is what she has to say. Kiera says, it was really good and meaningful that I have helped people in similar situations to what I have been through. Knowing that they can access the content easily and have the information right there for them at all times. It was really rewarding. It was a really rewarding experience and something I'm proud to be a part of, knowing that it will help so many people. Emily responded well to any feedback that I gave to improve the visibility and usability of the website. I'm grateful that the website was created because it's very much needed. I then asked Kiera, what is the importance of the website? And how could it have assisted you in your move between healthcare services? Kiera says, the website produced is incredibly important. Having a resource for adolescents to understand the process of transitioning, where they can access relevant information and have any questions asked, is very important. This resource would have undoubtedly assisted me moving from child to adult healthcare services. As a young person, moving to the adult system was extremely stressful and overwhelming. I didn't feel ready to leave the services of the Children's Hospital. Having a resource like this would have reassured me as well as helped me maintain more independence in the control of my healthcare. I believe a service like this would have allowed me to have more of a day and reduced my reliance on my parents and other healthcare professionals to navigate the system. I then asked Kiera, what is the value for young people and how it would benefit them in their transition? Kiera said, this resource is very valuable to young people due to it being a digital resource and easily accessible at all times. It can be hard to find the right person to talk to. I understand some young people may not be comfortable reaching out to their health services themselves. Therefore, a resource available to them right at their fingertips would be much less overwhelming as well as easier to navigate. I'm sure it would make these processes less stressful for young people. And lastly, I asked Kiera, how could health professionals promote the use of the website? And Kiera says health professionals could promote the website by having brochures about the website available at their clinics so they could spread the word to patients and their families who are about to transition. I think this would make people feel more confident and independent about their next steps, also promoting the website across social media platforms that young people are already using, like the Children's Hospital Facebook page. So I'd like to thank Kiera for sending those responses through. It's very insightful.